welcome. I am Carmen. I am a myofunctional therapist and your educator extraordinaire because this is what I do a lot of, is helping my community understand all the things myofunctional therapy. So today I'm going to be talking about mouth breathing. Mouth breathing is bad because it raises big red flags for other myofunctional impairment, things such as sleep apnea, sleep disordered breathing. When a person is mouth breathing, they are getting dry, unfiltered air that has no nitric oxide, which means the body is constantly starved of oxygen. This oxygen deficiency results in an increase in acidity in the body, results in grinding, premature degeneration, nobody wants that, right? And also an increase in cortisol levels. If you remember, cortisol is a stress hormone and it is a direct result of your body fighting to stay alive all night long. So when this stress hormone is chronically overactive and you're getting so much of it, this leads to things like an increase in anxiety and depression, digestive issues, heart disease, weight gain, low energy, trouble with cognition, memory, concentration, all of those things. Mouth breathing also affects very drastically the craniofacial development. You've probably heard me talk a lot about this, but when the craniofacial development is altered, this can also affect the success of nasal breathing. Another thing that happens is when somebody has low tongue posture and mouth breathing, that low tongue posture is also going to change the craniofacial development. Typically, we see when somebody's mouth is open, their tongue is pulled down. Now, the correct tongue posture, which is tip to tail in the roof of the mouth, this helps develop the autonomic nervous system, which is crucial for balance in the body. Now, I totally get it. This sounds counterintuitive, right? But when you open your mouth, you are getting less oxygen. Doesn't make sense, does it? Did you also know that snoring is considered mouth breathing? And when you snore, it aggravates the oxygen deficiency by making it more tightly bound to the red blood cells. You can Google the Bohr effect to learn more, and that would be B-O-H-R. That's a huge rabbit hole you can totally drop down into. Did you also know that mouth breathers have a 2 times greater risk for stroke in heavy snores than those who don't snore? So snoring, mouth breathing, you guys, is unhealthy. The important thing to remember here is that there is always a way to learn how to nasal breathe. It just takes time, which leads me to talking about why nasal breathing is so good. Now, it's good for you for a couple of reasons. First of all, a normal nasal passage is meant to slow down that airflow. So when that airflow into the sinuses is happening, the nasal passage is meant to warm it, humidify that air, and allow it to mix with something called nitric oxide. Nitric oxide helps the uptake. So it's going to help it get better, help that uptake of oxygen into the lungs so that overall your body is going to be better because it's going to have better oxygen saturation overall. Nasal breathing is also very important because it puts an expansive force on the upper jaw. So this means that when you nasal breathe, it helps develop the mid-face and stimulate the growth of the maxilla, which is your upper jaw. And this helps by growing forward and outward, which widens the arch, so it widens your palate, and it lowers the ceiling of the palate, so it helps bring that down out of the nasal cavity. So you're probably wondering, is there a time where it's okay to mouth breathe? And I do teach my clients how to unblock their nose so that at the first sign of congestion, they can short circuit that vicious cycle or that congestion cycle, as I like to call it. Now, obviously, it is okay to mouth breathe when you're working out really hard, but the goal is that I want you to wait as long as you possibly can before opening your mouth so that you get that steady supply of high quality oxygen. Now, many elite athletes, they will mouth tape to make sure that they are getting the very best. Optimizing oxygen consumption is very important for athletic performance, so you can see why they do that. So, what is mouth breathing and what causes it? So, mouth breathing is a learned habit when you begin to breathe orally instead of nasally. So, this typically happens when something has happened and you can't get adequate air. So, obviously, it's a survival tactic. So, you switch to breathing through your mouth rather than your nose. Now, this just becomes a habit after that because there's nothing really that says, hey, I should really switch back. So, what causes mouth breathing? There's a lot of things that can cause it. So, this can be an allergy, something that causes chronic congestion. It can be enlarged tonsils and adenoids, a respiratory problem, asthma, deviated septum, polyps, tumors, that kind of stuff. Each of these factors makes it physically impossible for a person to nasal breathe. So if nasal breathing cannot be established, then somebody is obviously going to mouth breathe. However, like I said, it's a learned habit. So if you can figure out how to correct that habit, then you can go back to nasal breathing. One of my mentors has always said that if you can nasal breathe for 1 minute, then you can nasal breathe for life. Now, when I do a comprehensive exam with somebody, one of the things that I am trying to make sure of is that the person has patent nasal passages, that they can nasal breathe. So I have them demonstrate 10 breaths, 10, 15 breaths. I'm watching their chest area. I'm watching to see if their shoulders are going up and down. I'm watching to see if they have just fear in their eyes. Sometimes people will have nasal passages that collapse. So again, I'm watching that because a nasal passage problem can prevent me from successfully teaching somebody how to nasal breathe. Okay, so are there other effects of mouth breathing on the body? Absolutely. So, mouth breathing has a lot of detrimental effects on the body. So, first of all, as long as the mouth is opened, speech is going to be distorted. Now, this may not be super obvious, but it's definitely going to be happening. Now, when you mouth breathe, you are also activating the thoracic or the upper chest muscles for breathing. This limits the use of the diaphragm, which is your breathing muscle. So, a lot of my clients who are mouth breathers, they're really weak, shallow breathers, and we have to really work to get them strong and breathing effectively and efficiently. Now remember, going back to that craniofacial development. So when somebody is mouth breathing, they tend to have gravity just pulling down on their face. So we see that long, narrow facial structure, vertical jaw angle. We might see weak, flatter cheekbones, a small lower jaw, crooked teeth. There's definitely dental concerns also. So perio disease, decay, dry mouth, potentially bad breath. We see ortho relapse. A lot of sleep problems. So poor sleep, chronic fatigue, daytime drowsiness, maybe workplace accidents. There's posture issues, a lot of digestive issues. Also behavioral issues, things like attentiveness problems, ADHD problems in children. The list can go on and on. So what can you do about mouth breathing? First, you have to correct that habit, and that happens through awareness training and also creation of a new habit to replace that old habit. Now, first of all, like I said previously, it's very important that I know that you can nasal breathe because that will impede the success of therapy. So sometimes this involves somebody else, so that could be a visit to the ENT, to the allergist, or maybe just some simple lifestyle and diet changes for things such as pet dander, dairy, those type of things. If you eliminate or reduce some of those items, then we can effectively help that nasal congestion and then effectively help that nasal breathing. Okay, so what should you do, right? I've thrown a ton of information at you. The biggest thing is if you are mouth breathing, you need help to get nasal breathing. As we get older, the establishment of nasal breathing is going to be so important to prevent mouth breathing, snoring, upper airway resistance, sleep apnea, all of those things that the sleep disordered breathing concerns. So it's really important. So you can do this by finding your myofunctional therapy person. It does not have to be it doesn't have to be me. It needs to be somebody. So with that said, you can find somebody local. You can find somebody like me who sees clients all over the world online. The most important thing is you talk with this person, you get an assessment, you get an exam, something that is going to move your needle towards getting healthier and total wellness. And that means breathing correctly. So you can find me on Facebook Live. You know I'm there most every Wednesday at 11:30 Mountain Standard Time, and that's on my Facebook. So that's over at the Tongue Trainer on Facebook. You can also download my freebie. So we have a new one, and it is our sleep tools. So that is our sleep diary. That is also 10 rules to improved sleep hygiene. So we're really focusing on sleep. Also, you can find us on Instagram, you can find us on YouTube, all the places. So find us, like us, share us, because we absolutely love to be here. I will see you next time. Bye for now.